the next talk is a little bit spooky, if you have seen the movie. The Fifth Element, Adding the Life to CAE by Professor Michael Gasik. Michael.
Thank you, Mr. Chairman. Thank you for a nice invitation. This topic is indeed a little bit strange, because I have been asked to deliver non-traditional and non-conventional topic, and I have think a lot about what would be the name or something like that. But that's actually what we find. And I'm trying to explain you what it all's about and why we want to add this fifth element to CAE. So we're talking here about the biomedical applications, and you have seen a lot of different examples: CFD, biomechanics, imaging, combination of everything. And the problem, or not the problem, but basically the main feature of that is they're mostly mechanistic in nature, so solution sought in space-time, but not exactly incorporating the living matter. And there is a lot of assumptions and simplification. If you take this kind of simulation up paper or book, you can find a lot of, yes, it's a nice results, but it assumes that and that and that. So the point is, from the biological point of view, that the cells, which is actually the living matter, and their reactions on any level, they are missing from CAE applications. Despite that, that is the main objective of biomedical applications, to live. So we have to assume that there is something which is not exactly engineering, even if it's called tissue engineering, but it's not so far engineering, it's more the tissue guessing or something like that. So why CAE applications are not there? First of all, it's a very high complexity, because the engineering data for living matter, as we know from engineering point of view, they are not available. Even if they're available, they have a high scatter, uneven output, and very little relevancy, or in some cases, just simply unknown. I just was listening to one talk of medical doctors which said that basically nobody knows in kidneys how much is a different cell population density. These data are not available. Even we saw that basically a medical doctor could take a biopsy and measure that. That's not done. So data which is available from that kind of simulation normally are force-fitted to oversimplified models, because there are no other models. And that leads to ad hoc cases which are very limited in prediction of already by the concept or by design. So that's very similar to the presentation we just heard this morning about the finite element, was it simulation or not. And what I think is missing is a lack of understanding for CAE potential from biomedical scientists, and also the biomedical problems are not familiar to CAE specialists, because they're not aware about what are the challenges and what are the methods. And because the cases are highly specific, the validation is difficult, impossible, guidelines are flexible, we have empirical science. When you go to doctor, what is all finished in 99%, well, take another aspirin, it will pass whatever it is, sooner or later. So what I would like to present here is just to promote the CAE talking to biomedical people, and vice versa, because it's so far missing or insufficient. So why we need CAE application in biomedical field? First of all, the new approaching which coming, advanced therapy medicinal product or tissue engineering regenerative medicine, they require very high confidence, and they cannot be based on singular models or input, because otherwise they cannot be justified to agencies, and if they're not justified, we need extra clinical trials. There is no time, there is no momentum, and finally that's too long time to take to develop anything. Then, that costs money. Why? Because if you have an expensive in vitro or in vivo test, a single in vivo test can take 10,000 euro, 50,000 euro per one just set of experiments. You waste billions of money, millions of animals are killed for nothing, just establish the model which work excellent in mice, but it has no relevance to human. So that's not surprising that up to 95% of all successful in vivo cases which has been ever developed in pharmaceutical industry, they fail in clinical trials, because the human is not a mice. it's not a rabbit. It has a cells which built on carbon and oxygen, but it does not work this way. Then we need to integrate engineering biomed applications in cross-supporting, because we have to balance between complexity of the model and efficiency of prediction. So we want to have models which really works and not just presenting something. And there are growing activities to do this in silico modeling, but very little CAE has done on systemic or organoid levels, even for so-called well-established cases. So what we suggest is to add fifth element. You already mentioned the movie, so I took a picture from that. And I have put the 4 elements of CAE, like mathematics, chemistry, computing, and physics, which is basically maybe it's 90 or even 99% of all CAE applications we are hearing today. So we want to add the 5th element is a life, which is not yet present there. And if we take an example for medical devices, whatever the aesthetic or functional or in between, we have a huge number of complications. There is a number of millions of cases all around the world, which leads to the suffering of the patient, because that's 4 different stakeholders involved in this process. As you can read below, we have surgeons who said the biomaterials are bad, everything should be nice, we did this okay, but biomaterials failed because it was not biomechanically optimized. The medical device manufacturer said 80% of failures are due to improper surgery, blames the surgeon, our materials are perfect. Researchers said, yeah, well, you know, we need more R&D to understand what it's all about, because we don't have data, and if we have data, it's scarce and very unreliable. And finally, we have patients who does not care all about that and said, we just want to live and we want to have the implant which works. So all of the things, they have to be combined together. And essentially, if we take an example, which I think many of you are familiar, and if you take orthopedic case with total hip replacement, take something like a biomedical state-of-the-art titanium alloy, and they evaluated a huge amount of separate tests. There are mechanical tests, biocompatibility tests, chemical wear, and whatsoever. But this test does not tell anything about the life, what happens with this implant. So what about osteogenesis or competition between bacteria cells, between the stimulus, what is the infection risk, cell metabolism, and how its nutrients are supplied, because its process is too complex to be described even in the simple physical equations. So, and if you look for the cell level, the cells are not just living as in some isolated space, even you can put it in a microscope, but they normally work within some kind of substrate. So if the topology substrate is changed, if the space available for cell proliferation is changed, if the stiffness is changed, or just the geometry change, you can have from a stem cell, you can have a cancer cell, or you can have osteoblast or whatever, and it is all managed by the combination of the parameters, which we have very little clue about. So there is something is known and something is not known. And if you look for the model of the cell, which you normally find in the books, that there is a tension which stretches cytoskeleton and nucleus. There are compression pressure, which alters local charge density, chemical concentration, ion channels, and so on. So there are nice pictures like that. But there are many theories which does not consider that the strain and fluid velocity are not independent in this case. Velocity causes different shear rates in different places, which is affected by nonlinear fluid viscosity, and which also drives with that the tissue permittivity, which change on the strain rate, viscosity, and loading history, and so on and so on. So basically, that all is so complex, so every additional to the model is look like a Ptolemaios model for our solar system, because then it's just added other epicycles and trying to describe the system, but still the Earth was in the middle, not the Sun. So if we just add something here, the results are maybe numerically good, but practically not very useful. If you look at an example which is more familiar for biomechanics, that is just a bone loss tangent in viscoelasticity. And you see here the theory which predicts when you use a Maxwell-Kelvin viscoelastic elements, you combine that, you see that in the bi model, and then you have the green life, which is real life. you can judge yourself whether there's any kind of this viscoelastic model combining springs and dashboards really would be any at all realistic to prescribe that one. And by red lines, you see the relevant areas, because that is the frequency range we are operating. We are 1 Hertz machine. The heart rate is 1 Hertz. Our walking is about 1 Hertz, plus minus, even running. So essentially, as you see, the skeleton is naturally optimized to have the lowest mechanical loss because of that what we are living. So if it's too low or too high, then we have higher mechanical losses. If we look for mechanoregulative fate of the bone, so that's also depends on the number of the daily loading cycle and microstrains. So I put here the 3 level, which is walking, running, and extreming. That means going to gym and lifting some heavy objects. And you see here the heaviest is a strain, the shortest number of cycle you have to do to stay within this line that the bone is not resorbing, there is no bone loss, but it's not only anabolically fractured, so because the strain are getting too high in the number of cycles. So in some cases, it's a window where all our skeleton is operating. And there is one also which I particularly like to add, which I call lazing in the sunny afternoon, which means that if you don't do any physical activity, go on holidays, your holidays has to be very long. So you may consider this an official proof that any time we go on holidays and doing nothing, just lay on the beach, you have to spend there almost a whole year to be physically recovered in terms of the skeleton. So how we do that and why we need this simulation, just a simple example, what we have there called the biomaterials enhanced simulation test is the best. When we put a simple specimen, just a 3-point bending and simulate mechanoregulative index, adding some cells here, you see on the diagram on the left that the expression of collagen 2 has been upregulated by 300,000 times versus a control which was not properly loaded. I don't know any engineering system which you can improve by 300,000 times by simply adjusting proper parameters. Maybe there are, but I'm not aware. So essentially, this kind of modeling, which has to be modeled in the frequency domain, which has to be modeled in the living domain, are very important to describe the whole living system. So when we translate that comfort tissue zones in terms of the gamma, the resolved strain, and fluid velocity, which is originated in the porosity layers, you can see that by adjusting frequency, you can create different tissue comfort zone to promoting either bone formation or cartilage formation or something like that. And this is one of the most simple cases you can have. So essentially, that's also true for all other organs we have in the body. So what we suggest is basically, if we're adding CAE to life, that would give a new life to CAE. And that means this is a picture of chondrocytes which has been proliferated on the mechanically stimulated specimen, and every green point is that means a live cell. And you can see that there is a certain anisotropy which create on the specimen. So what opportunities we have in the fifth element addition? The first is there are a lot of question marks. So it is just, let's say, provocative or suggestions to digitize the life science, to add life laws, whatever they are, on cellular, organoid, tissue, and systemic levels, to help to bring the CAE to more close to the real life. Maybe to go to feature extraction instead of trying to understand totally what happens. We don't need to understand how the body works if we enjoy a glass of wine, and surgeon does not care how many GPUs are in the computer if he looks for tomography image. So we probably have to consider more generic driving force and controls, because something we cannot control, we maybe don't know what is this, and maybe we are not able even to measure that without distracting the system. And when we go that with a more human relevancy, so we aim on replacement versus existing animal tests, so totally eliminate the animal test and get the more prediction ability for quantitative extrapolation. Then I was surprised that not so many biomedical people, even if there is a lot of good books, they know about proper data processing. So they still use traditional tests and p-values to describe that, okay, our experiment is good and other experiments are not. But to using the meta-analysis, multivariate meta-models, it's very, very low level still, which is used in this area. So I would encourage the CAE expert talk to biomedical people. Remember to use clear language, because otherwise they don't understand. And also listen and trying to understand what they're talking about. So probably one of the next topic for future, I don't know, is it for next 30 years, but maybe for next few years, will be to create some kind of a specific interdisciplinary live CAE conference to just to put all this, so people start talking with each other and trying to understand what is the problem and how we solve it. So finally, I can say that the slogan of that can be live and let CAE. Thank you very much.